If everyone wants to introduce themselves in the chat, feel free, no pressure at all. My name is Emily, she, her pronouns. I'm a recent graduate from the OHSU PSU School of Public Health. And I did my practice experience with OCFSN, specifically within the Veggie working group. And my main task was to create a sort of updated census of all the Veggie programs across the state, since that hadn't been done since 2020, when Marielle Slater from Cultivar LLC created a really awesome census. So that was my task. You've probably all received lots of emails from me, and I appreciate your kindness and your patience with me. So let me go ahead and share my screen so you can see presentation. Can everyone see that okay? Cool. Okay, so this is kind of in the form of a presentation, but it'll also be a PDF so that you all can refer back to this later as you like. And it will also exist sort of as a living document, just because, things are always changing. There was a couple programs who didn't have the capacity to participate at this time. So this will continue to be updated. So just keep that in mind. And this is something you can continue to look back on and see those updates. And also feel free to, there's fancy transitions. Feel free to jump in as you like and ask questions. I'm totally fine with that. You can also ask questions at the end. It is a pretty lengthy presentation, so I'm not totally sure we'll get through all of it. So maybe if you have comments or concerns or questions, bring them up as you think of them, just so we make sure we get to all of those. Okay, so this is kind of the contents of the presentation: methodology, definition of VeggieRx, current geographical spread, operations, eligibility / participants, redemption, funding / partnerships, program evaluation, challenges / successes, and then some limitations, and then a few things I added for the appendix. And then methodology. So very first step in this was to just establish a list of the active VeggieRx programs across the state. A little bit challenging, and I'm still not 100% sure it's completely exhaustive, but again, it's a living document. After that, I confirmed a location, contact info, other basic info of all those programs. Again, you might remember receiving some emails from me a few months ago. And then I wanted to create this census. And so I created a draft based off Marielle's 2020 version, and then asked you all for feedback. And then once I felt like I got enough feedback, went ahead and launched the survey. Program operators had a few weeks to complete that. That involved, reaching out to some folks, reminding them, giving deadlines, so on and so forth. And then lastly was the fun task of organizing the data, interpreting it, and presenting it as best I could. But do keep in mind that was a challenging task. And if anyone has feedback on the way this data is visualized and presented, please let me know. I can go back and change things, because really I want this to be as useful as possible for you all. So if something doesn't make sense in the way it's visualized or explained, please let me know, and I can certainly make adjustments to that.
Hi, folks. And I think the other thing too, to add, because first of all, I know this is the first time you're all seeing the presentation, but it is awesome. It's definitely as comprehensive as it can be right now. But part of why we're presenting this back to this group is to make sure that we get all of your feedback and all of your brains to be like, what else is stuff that we want to be keeping track of and being able to learn from each other, and what are kind of the additional layers of qualitative data that we also want to be able to capture. And so that's also part of, what Emily ended up making a list of is, I'm sure we're going to have future masters of public health students and other interns. So how can we get support in continuing to update this so that we have, it's not happening every 5 years, like we're keeping on top of it.
Yeah, thank you, Shin. Yeah, so definitely take this as an opportunity to kind of just think about what sort of information is the most useful to you for future iterations of this, and we can certainly implement that. Okay, so purpose of this, again, just kind of updating what Marielle created in 2020. There's a lot of traction with VeggieRx and some potential future funding streams coming through. So we want to just kind of get a good grasp on the current state of VeggieRx in Oregon in order to really figure out, how to best use those funds and identify potential leverage points for expansion if that's something we want to do, and potentially even some sort of standardization, potentially modeled off of Double Up Food Bucks, who have had a lot of success. And then just a quick shout out to all of you who so graciously filled out this very lengthy survey. I appreciate your time so much. And yeah, it didn't go unnoticed for sure. So just some logos representing all of you. And also just a quick little asterisk here. Rogue Food Unites did really generously fill out this survey and provided a lot of awesome data. Upon further investigation, I don't think they technically qualify as a VeggieRx program, so they're not included in the data of this presentation. But I still wanted to give them credit for participating. And then VeggieRx, I'm sure you all know this very well, but as defined by the National Produce Prescription Collaborative, VeggieRx is a produce prescription program used as a medical treatment or preventative service for patients. Patients are eligible either if they have some diet-related health condition or risk, food insecurity, or some other documented challenge to accessing nutritious foods. Typically, they're referred by a healthcare provider or a health insurance plan. And these prescriptions are fulfilled either through food retail or food retail in some regard, whether that is a CSA, farmer's market, grocery store, etc. And the ultimate goal is to enable patients to access healthy produce and ultimately improve health outcomes, really optimize healthcare spending, and then increase patient engagement and satisfaction. So that is the national definition of produce prescription programs. But in Oregon, from what I've gathered by doing this census, it seems like VeggieRx in this state typically exists as a partnership between some community organization and a CCO or coordinated care organization. Not always the case, but generally speaking. And the benefits of these programs can be prescribed by an array of healthcare providers. It certainly doesn't need to be just a physician or just a dietitian. There's a lot of folks who can to actually prescribe this. It typically entails regular allotment of fresh fruits and vegetables. And the main goal does seem to be addressing nutrition and food insecurity. However, there are several programs that also focus a bit on diet-related health metrics as well. Okay, so I wanted to kind of visualize where in Oregon folks are being served by VeggieRx. So I created this map using ArcGIS Pro, and I'll kind of explain what each aspect represents. So each little teardrop there is showing a prescribing site for VeggieRx. Some programs, they just have one. It's the same, the same people that are prescribing is where they're picking up, and there's just one of them. Other programs are much larger and have several prescribing sites. This is certainly an aspect that is will be updated, because I know that aspect changes a lot. But I tried to do this as best I could. And each color of the little icon represents the parent organization, for lack of a better word, which is kind of, there's a key to on the right-hand side there showing which program each color represents. And then the green, when the counties are filled with green, that just means there is at least one VeggieRx prescribing site. So kind of used as a proxy to show which counties are being served by VeggieRx. So yeah, just kind of a way to visually map out where across the state these programs are existing. There's a little asterisk there by the Silet's Food for Lane County program, since it won't be continuing this season, but still wanted to have it in there as a program that has existed this past year. So you can see there are several gaps in the state where there's not really any coverage. Marcy, you may have insight on, I think, was it? I forget which county this is on the right-hand side. I thought that the Frontier Veggie RX program did serve this area, but the prescribing sites didn't seem to exist there. So let me know if that needs to be adjusted, if that needs to be filled in. But for this,
yes. So Malheur County is served by Valley Family Health Services or clinic or something, and then Lake County also is active now, and we're going to be adding Baker County, so we're just adding them in.
Amazing. Okay, well, I might reach out to you after this and just get those specific sites, if that's an easy piece of information to get from you. Okay, so cool. This will be updated, so it's better than what this map represents, but generally it kind of shows where the gaps are. And I thought it would be useful to sort of compare those gaps to other health disparities and other metrics for the state. So I pulled these maps from various resources. This one here represents heart disease across Oregon, just to kind of show the patterns of a diet-related illness and the patterns across Oregon. So you can see the darker red areas are the areas most impacted by heart disease, which are also areas generally unserved by Veggie RX. And then this is a map depicting SNAP participation across Oregon. So I guess this will be updated since Malheur is served, but you can see Malheur, and then I forget what county that is. Let me know if anyone knows. But those two areas have the highest participation for SNAP, which sort of can be used as a proxy for level of food insecurity. And they're still pretty underserved by Veggie RX as well. Similar map here. This is just showing food insecurity itself, and you can see those darker green areas are underserved. Or experience the highest rates of food insecurity and are also unserved by Veggie RX. So, oh, and then there's one more map. This one's just showing access to farmers markets across Oregon. I thought this is kind of interesting, since farmers markets are another way that folks can access nutritious fruits and vegetables, particularly through the Double Up Food Bucks program, which operates kind of similarly. But mostly it's just another way to receive low cost produce. So I thought it was an interesting metric to include. And you can see those areas in Eastern Oregon are pretty underserved. A lot of the country, or a lot of the state is, but I thought it was notable since no real Veggie RX programs there. So yeah, I thought it was just interesting to look at maps and to compare that with the data of Veggie RX, just to keep that in mind for future efforts, in order to, focus efforts in the most equitable and effective way possible, ensuring that we're targeting the populations who are the most vulnerable. Okay, so moving on to the actual survey, it was split into 6 major sections. First one being operations. So here we cover years of establishment, full-time employees versus volunteers, participants that are served, various roles, prescribing healthcare providers. So yeah, we'll go into these one at a time. So this is just a little timeline showing when programs first started, and then kind of comparing that to a few major events throughout the past few years. So you can see 2018 was a really, really big year for Veggie RX in Oregon. And this is another one. If you see something that needs to be adjusted, please let me know. I phrased this question in a way that could be interpreted differently. So some of this may need to be tweaked. And then pretty amazing that Adelante has been operating successfully since 2014. So really cool to see that. Interesting to see the way this has kind of played out in the past few years. And then, yeah, you can see the 2014 Farm Bill was passed in 2014. Don't know if that was really related to all these programs starting shortly after, but interesting thing to think about. Similarly, in 2018, the 2018 Farm Bill was enacted, which, you know, had a lot of funds dedicated for VeggieRx through the GusNIP grant. And then just threw in COVID-19 there, since that's intimately related to food insecurity. And then also the Medicaid 1115 waiver, which we'll be getting semi-shortly. So yeah, just kind of a nice visualization of how long programs have been operating, which has been an average of 5.2 years, which I think is pretty awesome. And then next here, this is just showing the staffing patterns for programs. So I split this up for each program specifically. And this was a little tricky to visualize because a lot of you are operating with less than a full-time equivalent, which is goes to show how awesome you all are doing with such few resources for staffing. So the blue little person icon represents 0.25 full-time equivalents. And then the pink is 1 volunteer, the yellow is 1 full-time equivalent. So yeah, you can see very volunteer dependent, not a lot of full-time employees, but despite that, you all are doing really, really incredible work. So I think it goes to show, yeah, how awesome you all are, and how much we need more staffing. And then there's also a little asterisk for the SELECTS program, because that was actually only 0.15 full-time equivalents. This next one here was a little tricky to visualize. Please let me know if you have a input on how to best show this. I realized I phrased this question in a little confusing of a way, but this is just showing how many folks programs are serving, how many they served in 2022 versus the maximum capacity. So kind of interesting to see. This isn't a metric always measured by programs, but kind of interesting to see how programs are able to operate in comparison to their maximum capacity. So yeah. And then this is a word cloud just showing the various roles within a program. I hope to eventually visualize this in more of kind of a tree format to show a typical layout of the various roles within a program. But this just kind of shows that there's a lot of people working within this. There are some roles that seem to be common across the programs, others that are more unique for each. But this is kind of just a list of all of them. And then for this next one here, this is showing who actually prescribes VeggieRx for each program. So you can see there's a really wide range of prescribers. The little word cloud on the right shows all the roles that were listed. And the bar graph similarly illustrates the different roles, but other, which is the most, includes several different roles, which I listed at the bottom here. So I think the major takeaway is it doesn't need to be just a physician or a dietitian prescribing this. It can be a lot of people, which is awesome to be able to really maximize the reach of these programs. So I thought that was a really cool thing to see. This is showing the exact same thing, just in a different way. So if this is easier to visualize, then this is also here for you. So it just has the programs on the left and then a check mark if they use that particular prescriber. And again, the most right-hand column is kind of a bucket for all the other prescribers, which there are a lot. So key takeaways from operations, 2018 was a really big year for VeggieRx. A lot of programs launched that year. There are several programs approaching a decade of operations, which is definitely reason to celebrate. Like I mentioned before, VeggieRx finds a lot of success despite not having a lot of staffing. Programs are pretty volunteer dependent. And yeah, there's a lot of or a wide range of program capacity in terms of how many participants and patients they can serve, with a lot of programs still a little bit of ways from reaching that capacity, for various reasons. There are also lots of roles within a single VeggieRx program, and again, a really wide variety of prescribing healthcare providers. Okay, so that was operations. Now moving on to eligibility / participants. So here we'll go into referral / recruitment of participants, eligibility criteria, intended recipients, and then the flexibility of benefit size. So first, this question, I also realized it was phrased a little confusingly. It was meant to ask, how are patients recruited for these programs? How do they find out about them? And how do they get kind of enrolled? So it seems like the vast majority of programs, participants are referred by the patient healthcare provider. But there are a couple programs who find out via the local community in various ways. And then there is one program that operates more in a school setting. So they're referred by either by staff of the hospital or the school. So yeah, you can see this can happen in a lot of ways, but typically happens in the doctor's office, I suppose. Okay, so this question was looking at how folks are how it's determined whether folks are eligible to participate in these programs. So the primary criteria seems to be food insecurity. I believe it looks like it wasn't quite every program, but the vast majority of programs require food insecurity as one of the main eligibility criteria. That's followed by diet-related illness diagnosis, which can be various illnesses, including diabetes, heart disease, obesity, etc. So, and that's determined various ways as well, whether it's just, diagnosed by a physician or determined by biometrics. There was also a couple programs who just needed to be a part of the healthcare organization. And then in order to qualify, there was a couple programs who did use biometrics to determine eligibility. Some just needed to show that they were interested. One did need to show their actual income. And then for the SELECTS program, they needed to be a tribal member. So yeah, lots of different eligibility criteria, but the vast majority seem to focus on food insecurity and diet-related illness diagnosis. Okay, so this again is showing me the same information, just visualized in a different way, if this is better for your brain. So each column is showing a different eligibility criteria, and then the check mark means that that program uses that, and the X shows that they do not. So yeah, you can see SNAP enrollment was not a major eligibility criteria. Food security definitely was, as well as diet-related illness diagnosis. So just another way to look at this data. Okay. And then this is looking at the intended recipients of benefits, whether it is really, whether the program is fully focused on the person being prescribed, or if it intends to serve the members of their household as well. So it seems the vast majority do intend to serve members of household as well. 10 programs out of 11. So I thought that was pretty interesting. And typically when that happens, the size of the benefit does adjust depending on the number of folks in that household. So yeah, it's cool to see how adaptable these programs are and how the reach is actually far beyond what it may seem, because it's not just the person being prescribed, it's usually the folks they live with as well. So a lot of people being served by these programs. Okay, and then just some key takeaways from that. Again, most participants are referred to VeggieRx by their healthcare provider, though there are several other ways to find out about these programs. Food insecurity and a diagnosis of a diet-related disease are by far the most prevalent screening criteria, though there are several others. And then again, most programs, the benefits do extend to participant households, usually adjusting the amount of benefit accordingly. Okay, so that's what I had for eligibility and participants. Next section here is redemption. So this one has a lot of information. Redemption method, frequency of benefits, program duration, redemption location, transportation / delivery, the types of food included, re-enrollment, redemption rate, and then any educational and social components. So lots to cover here. All right, so this here is redemption method and benefit acquisition, or just how they actually physically receive the benefit. So it seems like, and I'll kind of explain how this pie chart is laid out. So the colors are showing the different types of redemption, whether that is a CSA / produce box, whether it's tokens, whether it's paper vouchers, or whether it's debit cards. So from that, you can see CSAs or produce boxes. I kind of group those together. Those tend to be the most common redemption methods here, followed by debit cards and paper vouchers, and then tokens being the most infrequent. And then within those colors, I kind of divided it up for how folks actually receive the benefit. So this one's a little confusing because, of course, for a produce box, the benefit is the method is the benefit, because they get the box. Whereas for the other three, tokens, vouchers, and debit cards, they first receive the debit card or the voucher or the token, and then they redeem it. So it's a little hard to compare here. So keep that in mind. But basically, you can see for CSAs, the vast majority are returned to program site, and the folks actually come and pick it up. One program you can return, or you can get the box delivered, and then one program it's just delivery. For tokens, the one program is returned to program site to pick up the token, and then they redeem it elsewhere. And then for paper vouchers, one of the programs, they get the paper voucher delivered. The other one, it's either delivery or return to pickup site. And then lastly, for the two debit card programs, the debit cards themselves are delivered. So again, kind of hard to compare here, since for tokens, paper vouchers, and debit cards, there's an added step there for receiving the actual redemption method and then redeeming it. Whereas for CSA / produce boxes, they're kind of one and the same. So keep that in mind. But I thought it was interesting that there's a lot of ways to actually receive these benefits, and delivery is often offered. Okay, so this is kind of similar, but just breaking it down by those 4 different methods, and then also kind of including the specific programs here. So I probably won't go into all of this. It's more specific information. But this is including, the frequency of distribution, the program duration, the value, monetary value per pickup, and then which programs are doing what method. So I know this is a lot of information. If you have feedback on how to better visualize this, please let me know. But basically, it's divided into paper vouchers, tokens, debit cards, CSA. And you can see there's a lot of variance in how how the benefits are distributed. So I'll give you a minute to absorb this. Hopefully you all can read it. And then I have a few slides that kind of break down the information a little bit more. So I'll just give you a little bit of time to look at this if that's useful for you. And also let me know if you have any questions while you're reading it. Okay. Probably was not enough time, but again, this presentation will be available for all of you to look back on. Oh, and I just saw a chat. Sorry, I have not seen any of the chat messages. For debit cards, how do patients/consumers know which items are eligible for purchase? That's a good question. So I think both of the programs that use debit cards use the About Fresh, Fresh Connect debit cards, which to my understanding, Carla, if you have insight about this, because I know you Adelante uses Fresh Connect, please feel free to chime in. But I'm pretty sure Fresh Connect, they work with grocery stores and they're kind of filtered for only being able to purchase fresh fruits and vegetables. I don't think that it'll actually work at checkout to purchase other items. I tried to research that and figure that out, but go ahead.
I don't know if Carla's still on. No, it looks like Carla had to hop off. So I haven't had an update in a while, but the last time when we first implemented the debit cards, because this was kind of the first time that they were working with farmers markets, and it was actually very manual in terms of it was really dependent on the particular stand to be able to say, hey, it's only eligible for these particular items within my shop. So that had to be something that was like human managed at this point. But I think in other programs that Fresh Connect manages, where it is grocery store, where it is like skewed items with SKUs, then it is easier to manage. But it's definitely unique if it's what's particular smaller independent retailer or store or farmers market.
Awesome. Thank you, Shin. That was helpful. Okay. So here, this is just showing the frequency of benefit as well as program duration. So vast majority of programs operate on a weekly basis, followed by monthly. And then there was one program that is every 2 weeks, but switching to monthly or to weekly, pardon me. So weekly will become even more popular. And then for program duration, around half the programs seem to operate in 6-month increments. So typically they're weekly allotments for 6 months, and then you may or may not be able to re-enroll after that. And then the rest of the programs here, it's just one program doing 10 weeks, 16 weeks, 1 year, 2 years, 3 years, and then there's a couple that are just as long as needed. Okay. And then this slide here is showing redemption location. So separately from how you get the redemption method, whether that is the voucher, debit card, etc. But here it's showing where you actually redeem that device for the benefit. So it's about half and half, or the two major locations are grocery stores or farmers markets. And then there's a couple CSAs online and then clinics. So this is another question that it could be phrased a little confusingly, because CSA was referring to the actual CSA location, but there may be folks picking up a CSA at a clinic, but it's still a CSA. So a little confusing, but major takeaways: farmers markets and grocery stores are the most common redemption locations. And then this right-hand pie chart is showing the number of unique redemption sites per program. So basically saying how many different places can you redeem your benefits at. So two of the programs, and this didn't have a whole lot of participation for this question, so it's not a completely conclusive pie chart, but from the data I did get, Two of the programs have no limit on the number of places the benefits can be redeemed. One program or two programs have just one site. And then there's one program where there's 5 different sites. Okay. And then this is showing whether transportation or delivery is offered to folks when needed. So I split this up similarly to a previous pie chart. So the kind of pinkish color here is showing, yes, there is transportation / delivery offered. The blue says no, there is not. And I wanted to subdivide this one into the different redemption methods, since again, it's a little bit different for CSA versus debit cards and tokens and vouchers. But you can see the vast majority of programs that do offer delivery are those CSA programs. But there's also debit cards and tokens there as well. Interestingly, the 2 paper voucher programs do not offer transportation / delivery. And then in terms of how delivery / transportation is offered, this happens in various ways, whether it's volunteers or staff actually dropping off the benefit, or picking up the participant and bringing them to the site. There's a program that uses a DoorDash partnership. There's another program that utilizes a medical shared ride program. Some bus passes are provided for folks. And then there's sometimes participants just pick up for other participants as well. But I thought it was encouraging to see that that this service is offered for a lot of programs, just kind of increasing the accessibility and the reach here. Okay, so next this is going into the actual types of food included in the benefits. Fresh fruits and vegetables for everyone. And then there was a few programs that beyond just fresh fruits and vegetables also included canned fruits and vegetables, dry staples, frozen fruits and vegetables, or a bit of animal protein as well. So the light blue here is programs that only offer fresh fruits and vegetables. And then the other ones are fresh fruits and vegetables plus those other options as well. So this kind of surprised me. I sort of just assumed all programs were only fresh fruits and vegetables, but it was interesting to see that there are a handful of programs that do offer other nutritious items as well. Okay, so this is looking at re-enrollment. So kind of completely evenly split here. So 4 programs, yes, patients can re-enroll after the program duration has completed. 4 programs, no, you can't re-enroll. I'm assuming just to maximize the number of folks that are served. And then 4 programs, it's sort of ongoing / not applicable for various reasons. So yeah. Okay, and then this one is looking at redemption rate. So I thought this was pretty awesome. So the vast majority of the programs that answered this question, the redemption rate is 80 to 100%, which of course is really high. And then just 2 programs are 40 to 60%. And so this question is referring to what percent of the CSA / produce boxes are picked up, or for those vouchers / debit cards / tokens, what percent of the funds loaded onto those are utilized. So generally it seems to be a really high redemption rate, which is encouraging, that folks are using the benefits and hopefully getting the health benefits from it. Okay, and then this question was looking at educational components. Vast majority do include an educational component, though this occurs in a wide array of methods. So there's nutrition education, there's garden education, recipes, cookbooks, newsletters, there's little cards with tips on them, there's demonstrations, guest speakers, cooking videos, one-on-one check-ins, so on and so forth. So Pretty interesting here to just see there's so many different ways you can supplement these programs with an educational component, to really kind of bolster the way folks can use this produce, since a big barrier for utilizing the produce and getting enough fruits and veggies is just knowing what to do with the items. And then sort of similarly here, this is looking at a socialization component, which can mean many things. The majority here, again, does include some sort of socialization component, whether that is the in-person classes, whether it's phone calls, whether it's a Facebook group, events, or just interacting with the staff that's assisting them. And then I just included a few quotes here to kind of to supplement this as well and provide a little bit more context. So you can see COVID caused a bit of a shift for a program. And then, some programs have tried things like Facebook groups, but they haven't had success, so had to pivot. So I'd imagine this is a very iterative process that evolves a lot with changing needs. And then, though most programs do include an educational or socialization component, the vast majority of those programs do not require those components in order to continue receiving the benefits. So, and I would be interested to see, I should have included the programs that say, yes, they're required, what method that is, because it may just be they go and pick it up, and when they pick it up, there is a class happening, so it's sort of built in. But interesting to see that though this is offered, not typically required. Okay, so for some key takeaways from the redemption section, CSA/produce boxes seem to be the most common method of redemption, with most of those programs providing delivery to those who require that. The majority of programs provide the produce on a weekly basis, typically for a duration of around 6 months. Primary redemption locations are usually grocery stores or farmers markets. And then every program includes fresh fruits and vegetables as their benefit, with several programs offering other food sources as well. Again, the frozen fruits and vegetables, dry staples, and animal protein. There's an even split between whether programs allow for re-enrollment or not. Most programs have that really high redemption rate between the 80 and 100% percentage, which is awesome. And then, like I just mentioned, vast majority of programs include an educational component, most including socialization as well. And participants typically are not required to participate in either of those. Okay, so that's it for redemption. Next is funding/partnerships. So we'll go into funding sources, CCO partnerships, and then kind of thoughts on future standardized currency. Okay, so this is looking at the primary funding sources for programs. So majority here are CCO funding plus private grants or private funding only. So I thought that was interesting. Those are both tied for 4 programs each. So those are definitely taking the lead there. And then there's one program that's just a GusNIP grant. And then there's one program that's CCO plus nonprofits. So just, kind of interesting here to see the different ways programs are funded. You can see CCOs are a major contributor, as well as lots of private funders as well. And then next here, I've sort of mapped out as best as I could the CCO partnerships across the state. So you can see this kind of Western region is really highly served by CCOs. So we have Pacific Source, Care Oregon, Trillium Community Health Plan, Advanced Health, Umpqua Health, EOCCO and a couple different regions there, and then Gobi as well. So just kind of a way to visualize where in Oregon these CCO partnerships are taking place. Okay, and then this slide has quite a lot of information on it. But basically this was the question asking if folks would be open to a sort of future standardized VeggieRx currency or some other method to manage the benefit, if VeggieRx were to become a more statewide program. So it seems to be kind of across the board. There are some programs that are very excited about it, are ready for standardization, really want debit cards to be the form of standardization for currency. And then there's other programs that are open to it. Actually, no one said no, but there of course are there's hesitations in this, understandably. So from what I could gather, it seems like the primary hesitations here are, being able to continue supporting the smaller partnerships, the smaller grocery stores, the smaller farmers, and then I'm just kind of reading it again here. Yeah, so it looks like to be able to maintain those partnerships that they've worked really hard to foster, and then to continue supporting the more local food sources. So yeah, various feedback here in terms of wanting to adopt a standardized VeggieRx currency, but kind of interesting to see what people's hesitations are here. So okay, and then this is key takeaways for funding and partnerships. Vast majority of programs rely on private funding, with about half also utilizing CCO funding. There's a pretty wide spread of CCO VeggieRx partnerships across the state, with the major gap existing in Eastern Oregon, though they are served by EOCCO and Gobi. And then again, thoughts on a standardized VeggieRx currency do vary widely, with most programs feeling open to the idea, but various worries about logistics and partnerships. Okay, so next section is program evaluation. So here we're looking at tracked measures, participant feedback, and then program self-evaluation. Okay, so a lot going on here. This is, pardon me, this is showing what measures are tracked throughout the program. So kind of separately from eligibility criteria, that is looking at just what's required for folks to actually be eligible to enter the program. This slide is looking at which measures are tracked throughout the program, whether that's before and after or continuously. So this was split up by program, and I will display this in another way in the following slide, but you can see it shows both what measures are tracked as well as how often those are tracked. So some programs are annual, some are through a pre and post survey, some are twice per year, some are every 6 months. And you can see the primary measures here seem to be level of food insecurity, as well as self-reported health measures. So interesting to see this as well, because this is a big way of measuring how effective these programs are, in terms of how they're impacting individual levels of food insecurity, self-reported health measures, biometrics, literacy in being able to use fresh fruits and vegetables, and so on and so forth. So you can look at this more in depth if you would like, but I have another slide here that kind of shows the same thing, but in a different way. So it's easier to see here that food insecurity and self-reported health measures are certainly the most common tracked measures throughout programs. But folks also do use biometrics, mental health, food literacy, diet changes, and then there are a few other metrics as well. So yeah. And then it does seem that vast majority of programs do seek participant feedback as well, assessing their overall satisfaction with the program. So it looks like 8 programs said yes, they do ask for participant feedback, and 3 do not. And then sort of similarly, this here is looking at that this was phrased in a slightly confusing way, but this was intended to ask about program self-evaluation and how they ultimately assess the efficacy of the program. So I split this up by program. So this happens in various ways. It seems the most popular method seems to be a pre and post survey, which I know has been standardized for folks who want to utilize that. So it's just a survey that participants fill out before and after. But there's also surveys with the actual physicians. There's biometrics that are used. So this is just another way to look at how programs are evaluating themselves and the efficacy of the program. So key takeaways from program evaluation. Again, majority of programs rely the most heavily on tracked levels of food insecurity and self-reported health measures to evaluate program efficacy. Most programs seek participant feedback, and then the vast majority of programs include some sort of program self-evaluation, often in the form of pre and post surveys. And I also recognize that participant feedback and those surveys often blend and are sort of the same thing. And programs are self-evaluated using that participant feedback. So not totally mutually exclusive, but I kind of wanted to separate them a little bit. Okay, so next section is challenges / successes / moving forward. So this was a little hard to visualize since it was mostly quotes, but I tried to do it here and kind of split it up into major themes. So it seems like staffing / capacity, program site communication, reliable participation, funding, and partnerships. Those were the primary continuous programmatic challenges. So this is just looking kind of like on a day-to-day basis, what are the major challenges here? It seems like partnerships, and that can mean a lot of different things. That can be partnerships with funders, with CCOs, with other local organizations, or the debit card companies. Those can create logistical challenges that several programs felt. There's lots of challenges with communication, whether that's translating things into the languages that best meet the needs of participants. Whether that's just reaching folks via newsletter or other forms of communication. A couple programs had issues just with the physical site. Staffing / capacity was a really big one for continuous challenges. Participation, reliable participation was challenging. And then of course, funding as well. So this slide is again looking at kind of just the day-to-day challenges, whereas this next slide was getting at more what is specifically acting as a barrier to expanding the program. And here it was very clear that capacity / staffing was the main barrier here, which was visualized earlier on too with that table showing the number of full-time equivalents versus volunteers. So again, most programs are operating with very few full-time employees. So with that, there's just limited capacity to do all the things. Despite that, programs are doing really incredible work, but there's a lot of room to have more capacity here. So I included some quotes to pair along with this, but you can see capacity is the main barrier, followed by reliable funding, various logistics, and then partnerships as well. So I'll let you all read these at your own time, but there's some really powerful quotes here to provide context for this data here. But yeah, definitely seems like capacity and funding and logistics are the primary barriers here in order to reach a wider audience. And then also really important to focus on successes too, because again, despite all those challenges, VeggieRx has done really incredible things across the state and have really impacted a lot of people's lives. So here are just some awesome quotes that you all provided, highlighting various aspects, but it goes from improving folks' actual health outcomes, having program flexibility to meet people's needs, just positive participant feedback and folks really appreciating the produce and feeling like they know how to use it. Great participation, great partnership. So wide range of successes, but I wanted to include this here too, to also highlight what is going well.
Yeah. And I also wanted to add in here too, because I know we don't have data from the team at Zanger for the CSA Partnerships for Health. They do still plan on sending that in. They're just a little short-staffed right now. But one of the key things that they pointed out is, they have partnerships with, 3 farms. And so that's also something that's really helpful for local food and local producers, because if you have a guaranteed outlet, then, for a lot of small farmers, I think there's a lot of challenges with having to manage such like a vertical business of like growing the food, but then having to go to a farmer's market or manage a separate CSA and find CSA and folks and selling those shares, and then all the other pieces that go along with that. So I think that's another layer too of it's helpful for in a lot of different directions.
Totally. Thank you, Shin. And they also have a lot of prescribing sites too across Multnomah County. So yeah, their reach is really wide, which is awesome. I'm also realizing it's 11:04, so I'm going to kind of zoom through these last ones. Key takeaways for challenges slash successes slash moving forward. Again, partnerships, communication, and staffing are the most common programmatic challenges, with staffing and capacity as the greatest barriers to program expansion. And there's a wide range of programmatic successes, again, including positive participant feedback, improved health outcomes, successful partnerships, program flexibility, so on and so forth. Okay, so that's the end of the actual data. I also have a slide here on limitations, which I have sort of included throughout the presentation, but unable to get a hold of a couple potential programs that might exist. I just haven't found a successful contact. And then, like Shin just mentioned, CSA Partnerships for Health hasn't had the capacity to complete the survey. However, they do plan on doing so in the coming months. So we'll include that data later on. Some of the questions were phrased in confusing ways. And then, so it was hard to compare some of the metrics. And then programs just operate really differently, which is really amazing. Can make it a little tricky to compare certain metrics and certain data points. So, take some of those things with a grain of salt, but yeah, it's also cool to see the way that programs operate differently in order to, meet the unique needs of their population. And then just a few thoughts on potential future research. I think it'd be really awesome to include more participants and community members to really get their perception of these programs and their experience with these programs. Since of course this is all for folks, for those participants. This is, I guess, a little specific, but ArcGIS Pro, you can do a site suitability analysis, which is basically looking at what is the best location in Oregon to launch a new VeggieRx program. And you can use various metrics to assess that, but could be a useful task to do with any future funding streams. And then lastly, I think it'd be really valuable to look at more longitudinal studies to see how these programs are impacting folks in the long term and how it's impacting their long-term health and their long-term diet changes as well. So that's basically the end of it. There is more to the physical presentation. I won't go over that because it's basically the actual survey, just so you can go back and see which exact questions were asked. And then I have a few other tables here that show some of the raw data. And there's also a link later on to the actual raw data. So feel free to look at that too if you want to see exactly how folks responded. Since again, there's a lot of interpretation here that I did that may have gone wrong. So yeah, this will all be sent out to you. So feel free to look at it as you like and to pull the data as you like and use it in whatever way is most beneficial to you. So we have a few minutes left if anyone has any questions or anyone wants to bring up anything or if you have any feedback. So yeah, thank you all so much for listening. I realized it was an hour, time flies. But yeah, let's see. I want to just stop sharing my screen. Okay, great. Marcy, you have a question?
Yeah, not really a question, maybe more of an observation. I realize that, our Frontier Veggie RX program is serving 6 counties and getting ready to serve a 7th county. I can see how maybe in the future I need to answer the surveys like for each area or for like each county that is served, because even within our counties, it's different. Like some prescribers are from clinics, some are just volunteers within the community. And so I see that it would be important to maybe answer each county separately in their own like survey.
Yeah, I kind of realized that too. And the way the survey was created, it was made to just do it one for the entire parent organization. But I kind of had the same realization while looking through the data, because yeah, each program or each like prescribing site is very different and kind of functions as a separate program. So yeah, in the future, I think it would be best to separate that site to site. But learning opportunity.
Yeah, and I capture that as in the notes to kind of consider that. Was there anything else of that sort that kind of comes up of what are some other ways that maybe we should be framing or like the questions and the way that we go about collecting the info?
I just have really appreciated being able to talk with Emily about our projects and our programs and having all of this information put together so succinctly and presented in a manner that's easy to understand. It'll be interesting to see how this compares like year over year.
Thanks, Marcy. It's been great working with you as well.
If folks don't have other questions specific to the presentation, I'm happy. Well, first of all, you can always email us and reach out, because I know sometimes it takes us a little bit to internalize and process a very in-depth presentation. So thank you again, Emily, for all of your help this past year. And absolutely let us know how we can support you in whatever the next step is for you.
Thank you. It's been wonderful working with you all. You're all amazing people doing incredible stuff. Very inspirational. And I'm going to put my email in the chat too if you have specific questions for me that you'd like to ask about. And then, yeah, we'll get this presentation sent out to all of you so you can look back at it in your own time.
Yeah. And then I would say if this content is useful for anyone in just for your organization's use, please use it, right? I mean, I think part of why we all keep gathering as a working group is, trying to figure out how do we make Veggie RX a more commonly known thing, and how do we show and share the impact, and also, I think across all different streams of, whether it's participants or more community organizations or, on the healthcare end of things. I think there's so much that is happening well that, and then there's also like what are the things that we are able to do when we get organized? And one of those things is, I know paper vouchers and I know that, a couple of the teams had piloted a debit card program. One of the challenges with using whether it's, like a debit card, that kind of organization, or software as a service, for example, for tracking other things. That's always challenging when there's not enough buying power. So you're just one little nonprofit trying to get the attention of a vendor that is working with a lot of much larger organizations. So I don't know when this will happen, but it's always thinking about what are some of the ways that we can potentially organize to have greater buying power, because sometimes that is, for certain aspects of the work, important. And then what are also the ways that we can continue to stay flexible and adaptable to, be responsive to the very specific communities that are being served. So, yeah, Marcy.
Yeah,
feel
I
free.
have a couple really exciting announcements just to make, and just because I just want to share. So we were able to receive a Roundhouse Foundation grant to move forward our technology, to move from the paper vouchers to an e-card system, which is super exciting. And then the second announcement is Safeway. So in Lake County, we've been partnering with Safeway, which is the first in the whole nation of a rural program that Safeway has been partnered with. We're using their Just For You rewards program. And it's been going on since December, and it's been going well. And we are going to be able to expand that now to Baker County when we start in September, and Harney County as well. So Safeway Albertsons Corporation it took us a while to get that partnership going, but now that it's going, it's able to expand. So I'm really excited about that, and hopefully in other areas that can occur as well.
Thank you so much for sharing that exciting news, Marcy. That's amazing. And I know we are at time, so thank you everyone for joining today. Thank you, Emily, so much for all you've done. And I'm really excited to continue building on what you put together.
Thanks, everyone. I appreciate you all listening for the past hour.
Have a great rest of your week.
Thank you, Emily. It was wonderful. I appreciate all that hard work. And it's a very valuable product for us all to be able to use this information. So gratitude.
Thank you, Michelle.